Matthew Taylor, should NHS employees be required to be vaccinated as a condition of employment?
I think that is not necessary. The overwhelming majority of NHS staff are choosing to be vaccinated. And the important thing is to support people, give people the opportunity to be vaccinated. So I think we would want to say that there is no necessity for compulsion, kind of surveillance of people at this stage, because the staff themselves are doing the right thing.
So you wouldn't be putting any energy into consulting on that, as the minister told us he was going to do earlier on?
I think if we felt that there was a real issue there, then it is something that needs to be addressed. Of course, health service workers, like anybody else, need to take responsibility for the decisions they make and the implications they have for other people. But I think that what we should focus on is the fact that overwhelmingly NHS staff are doing the right thing, and indeed, working beyond their hours, and have been dealing now for 18 months with a national crisis and dealing with it heroically. So, I think the question is not, are there some NHS staff who aren't vaccinated? The question is, how do we support those NHS staff who have been doing what we need them to do through this crisis?
Let's look ahead. Let's look ahead at what's in prospect. If the government decides to vaccinate 12 to 15-year-olds or to offer a booster jab to older people, do you think the system is resilient enough to cope with that demand?
Well, we've seen heroic efforts in terms of vaccination, and that continues. And there are issues about supply, there are issues about capacity, and clearly the government has to make decisions in terms of who it is that it prioritises in relation to this. And these are difficult choices. Nobody pretends that they're not, in terms of making a booster available to people like myself, older people who've had 2 vaccinations, and also to younger people, because of the importance of ensuring, not just trying to minimise infection rates, but also to ensure that young people are able to carry on in education. So, the health service stands ready, as it has done over the last 18 months, if given the resources, to lead this national vaccination programme, which has so far been a major success. But, Trevor, this is part of the question of living with COVID. And, the first part of the vaccination programme was to get people vaccinated. And now we have to think about what is required in terms of boosters, also in terms of flu vaccination. So these are hard choices. It's important that the government is open about those choices and takes the best advice that it can in terms of who it is we should be prioritising.
You published a report this week which, to be honest, described a system which is pretty much on the edge. Your report said that COVID-19 had a seismic impact unlike anything the NHS has faced in its history, and it to describe the last 2 months as winter in summer. Do you believe that you've got the beds and the people, the trained staff, to get us through to next spring?
Yeah, it's tough. And you're absolutely right, Trevor, that the leaders or members of our organisation tell us that it feels, and we're just coming out of summer, that it feels like a midwinter crisis, all parts of the NHS, not just hospitals, the ambulance service, GPs, community, mental health services. We are running on hot, and you can't do that forever. And so that's one reason why it's incredibly important to get some clarity from the government about the funding for the rest of this year, that we sustain that funding, and that we have the funding that we need, on the assumption that the pressures of COVID are going to continue. And that's what it looks like is going to happen. So the 2 big challenges for the health service are funding the ongoing costs of COVID, and that's the patients in hospital, over 7,000 in hospital right now, PPE, the pressure on mental health services, long COVID, which is a major issue. And then secondly, the backlog. We have, as we know, well over 5 million people on waiting lists. The Secretary of State himself has said that he thinks that figure could rise a great deal more, and we need to fund that care as well. Now, yes, there are major issues about workforce. There are issues about the kind of capacity that we have. But it is important to say that if you give the health service the resources that it needs, it does the job. And even in these last few months, while we're still coping with COVID, we have seen substantial progress in relation to those people who've been waiting the longest time. And we've seen progress also in other critical areas, like making sure that we are checking people for the danger of a cancer diagnosis. So despite these pressures, where the NHS has the resources, it makes a difference. But we need that resourcing to continue, firstly, for the rest of this year, and then for the years ahead.